move to the bill hearing on Senate Bill 5701. If we might have a briefing, please.
Certainly, Madam Chair, members of the committee, again, for the record, Evan Klein, staff to the committee. Before you is Senate Bill 5701, creating the Washington Apple Care Trust. By way of a brief background, residents of Washington State currently receive health coverage through a variety of market, employer, and state and federally funded options. The state-established health benefit exchange provides a platform for accessing the individual market Medicaid, and individuals who have individual market coverage through the exchange may be eligible for federal premium assistance and cost-sharing subsidies. The bill before you establishes the Washington Apple Care Trust as an agency of the state to provide health coverage for all residents of the state. All residents are eligible for coverage through the trust. Benefits provided by the trust are secondary to any health insurance that residents otherwise have. Non-residents are covered for emergency services and emergency transportation only. Residents covered by federal health programs will remain in those programs until all necessary federal waivers are received, unless the resident elects to voluntarily participate in the trust. Employees covered under federally qualified trusts are not eligible for the Apple Care Trust unless they meet certain exceptions or until their federally qualified trust is integrated into the Apple Care Trust. The trust is to be governed by a 9-member board of trustees. The board must appoint a financial advisory committee, citizens advisory committee, and technical advisory committee, and consult with these committees in carrying out all of its duties. The board is directed to adopt bylaws, keep a current set of covered health services, seek necessary federal waivers, request legislation to authorize the assessments and premiums, develop or contract for a healthcare data system, develop healthcare practice guidelines, develop confidentiality guidelines and eligibility rules, balance provider payments and revenues, monitor population migration related to the adoption of the healthcare system, and develop an annual budget. The board must also adopt rules to allow providers to collectively negotiate budgets and other terms and conditions. The board must design a single benefit package that constitutes minimum essential health coverage under the Affordable Care Act, and including certain provisions that are outlined in the bill. If the trust has sufficient funds after 3 years, it must begin to cover long-term care services. After 3 years, the board must also submit a plan of operation to provide dental coverage. Prescription drug and durable medical equipment manufacturers are required to provide their drugs to Washington State at the lowest rate offered to federal and other government entities. The Joint Select Committee on Health Care Oversight must contract for an actuarial analysis of the funding needs of the trust and recommend a funding mechanism which may contain premiums, assessments on employers, and other funding sources. The trust is exempted from state antitrust laws. The trust does not limit an employer's right to maintain employee benefit coverage, and the taxes on manufacturers and processors of various foods and the premium and prepayment tax on healthcare services are repealed. There's no fiscal note available at this time, although it has been requested. I'd be happy to answer any questions.
Are there any questions, staff? Seeing none, Senator Fraucht, please come forward. Would you like to introduce your bill?
Sure, thank you. Madam Chair, members of the committee, Madam Ranking Member, thank you again for scheduling this bill for hearing. And this bill has been introduced in various forms in the last 6, 7, 8 years, I think as long as I've been in the Senate, which would be 7 years. This is the first time I can recall that we've actually been able to have a hearing, and I think by the turnout behind me from Healthcare for All Washington and others who feel very passionately, this is a conversation that we need to begin in this state, and I think really in the country. And I would just note that every transformational idea that we've had in this country, be it Social Security, be it Medicare, begins with a conversation like we're having today. I think that when Franklin Roosevelt proposed a Social Security system in the 1930s, it was probably a group of people who felt like the time was right and like-minded lawmakers who started the conversation in a hearing room just like this in the Congress. I see Senator Conway, our resident historian, nodding, and I think he would agree with that. The same thing in the 1960s when Lyndon Johnson proposed Medicare, that the radical notion at the time that we would bring all of our elderly individuals into a system, a healthcare system, a universal healthcare system. And so that's what this bill is designed to do. Now, obviously, there's a lot of parts of this that should be open to debate, and we have to work through many issues. And I think that's what's important about this bill, is that we're starting a conversation today, and actually a lot of the decisions are put forward in a future committee of experts to determine. And we know there are big financial issues we've got to deal with. For example, Representative Jayapal, our former colleague, is working on legislation at the federal level on how you would potentially move federal payment streams into a state-based universal healthcare system like the one that's being proposed here. So I don't come before you saying this is every answer is contained in this bill, but I do say that I believe that every person in this state deserves healthcare. And I believe that we need to think transformationally about what we're doing, that I think we can do this in a way that builds on the successes we've already had, and that the conversation that we're starting today is the right one to be having at this time in our history. And so I really commend you for bringing forward the bill today, and I look forward to hearing the testimony. And I know there'll be a lot of passionate opinions about this bill. I know many of my friends on the other side of the aisle are very opposed to this concept, but it's a conversation worth having and really fleshing out what could work and the problems that we need to solve. Thank you so much.
Thank you, Senator Frocht. Are there any questions for Senator Frocht? Thank you.
Thank you.
Thank you for being here.
Okay, first panel will be Lynette Vers, Dennis Delwo, Sherry Weinberg, and Carmen Mendez.
And due to the great interest in the bills that are being heard today, we do have a great number of people that we need to accommodate who have signed up to testify. And for that reason, I am forced to have to institute the 1-minute time clock. And I would ask for your help in being as brief as possible. And if you each have similar points, just reinforce those points and allow us to accommodate everyone who's signed up to testify today. Thank you. Please go ahead.
Thank you, Madam Chair and members of the committee. I am Dennis Delwo, and very fortunate to have been a member of the House as chairman of the Insurance and Banking Committee, and then later the Healthcare Committee. During my time there, we passed legislation that has been copied by Massachusetts and copied by President Obama, and has now given us the authority under a waiver to do exactly what we're doing here today, and that is coming up with a program that will, in fact, provide better coverage than the present system does, both in the state of Washington and nationally. And it is something that this is designed, as the sponsor said, to answer many questions as it goes through the process. You will have a committee that will be able to look at each of these elements as they did in ours and be able to give you the answers that you're going to need as this process goes on. It's something that I would warmly support and suggest that you do the same. And thank you, Senator Conway, for your historic support of this. It's an excellent piece of legislation that Washington would be very proud to be the first, second, or third of this.
Thank you, sir.
In this.
Senator Conway has a question.
I must admit, you know, when I came into the legislature, this bill was on the floor of the House, and my first role was to help the good chair respond to all the amendments that were on this bill in the floor of the House. And so it's great to see you here again, Denny. It's been a while. So.
Well, thank you, and I appreciated your support getting the votes we needed then, and do the same for us here. Thank you very much.
Thank you.
Hello, my name is Lynette Vers. I'm from Spokane. I'm a registered nurse, and I'm speaking in support of 5701. As a registered nurse, I want to illustrate to you why this is so absolutely needed. I have cared for patients for 42 years. And in that, just to give you one story about a woman in her 50s with insurance, and we were taking care of her at home, changing dressings. All of a sudden, the insurance company, no, not her health care provider, the insurance company said, we need to stop. We'll give you 3 more visits, teacher, and pull out. We did. 6 months later, I got a phone call. They amputated her leg. That is not necessary, and that happens every single day in the state of Washington and throughout the United States. Please, strongly consider this.
Thank you. Good morning.
Hello. My name is Sarah Weinberg. I'm a retired pediatrician and a longtime advocate, would you believe 30 years, for a national universal publicly funded health insurance plan for the United States. I am also one of the original authors of the Washington Health Security Trust Bill in the year 2000. Do you realize how long ago that was now? And I'm the president of the Western Washington chapter of Physicians for a National Health Program. Of course, as advocated by PNHP, a national health insurance, health coverage system such as improved and expanded Medicare for all would be the gold standard. But meanwhile, it is possible for our state to make a significant improvement in publicly funded health coverage for our residents. I am testifying in support of SB 5701 because if enacted and implemented, it would end uninsurance in our state, despite the fact that there are federal restrictions that would prevent any state from setting up a 100% single-payer health coverage system absent federal cooperation. The bill creates a path forward for Washington to stabilize health care across the state with or without federal participation.
Dr. Weinberg, if you could conclude. Please.
Pass this bill, and Washington state will be the Saskatchewan of the United States.
Thank you. Thank you. Please go ahead.
Hi, good morning. My name is Carmen Mendez, and I am a city council member for the city of Yakima. But today I'm not here as a council member. Today I'm here as a daughter of mother who works at a packing house in Yakima. And for the last 25 years, she's been working there. And it's really tough to talk about this because of some of the consequences that this job has cost my mother. She has been denied her surgery for carpal tunnel, just doing the same remote packing apples every single day for the last 25 years. And every single day she wakes up at 5 in the morning and goes back to work. So it's really tough as a daughter to see that. And so I hope that you really do consider the passage of this bill and how important it is for communities like Yakima and Central Washington, rural communities that at times parents don't have the ability. My mom never went to an appointment because she had two jobs in order to make ends meet. So I do urge and hope that you really think about those individuals that don't have access to take a day off from work, that don't have the ability to just not go to work and go to the clinic and wait till the very end until it's too late, where they end up at the emergency room. So I really do urge you to consider this and support the bill.
Thank you very much for sharing the personal story. I appreciate it.
Glenn Anderson, Catherine Angel, and Carol Butterfield. And on deck will be Ken Fabert, Rial Johnson, and Matt Reedy.
Please come forward. It may be that. Yes, sir. Please begin and share your name, if you would.
Rial Johnson. Hi. I'm here to testify for Senate Bill 5701. A little background about me. I was actually, well, I always hear that, you know, we just can't do it. It doesn't cost enough, or it just can't do it in this country the way things are. And you go around the world and you see how things are done, and they're done better. And this is America. We're supposed to be able to do things better. I was born in Canada, and I've lived in Canada part of my life, but I grew up here. And to see the difference in various countries that share a lot of similarities, and to see when you come back here and you see the people that are living like with the work that I do, just the on the ground struggling and worrying about not having health care, including my own family, it's frustrating, and it's disappointing. And this is why I think seeing people that this community bring forth this bill to the legislature, we have to get it done, because it's a step in the right direction, and I think it's going to help everybody else, everybody in the state, and it's going to show a
Mr.
model
Johnson,
in the country.
To clarify, you don't currently have health insurance for yourself or your family. Is that, am I understanding correctly?
Currently, no.
Okay. All right. Thank you. Please go ahead.
Yeah, thank you. I'm Glenn Anderson, a lifelong Washingtonian for 69 years. The lack of universal single-payer health care caused my cousin's son, Jonathan, to die. We have this screwy notion in this country that your health care is dependent on your employment status. Jonathan had a job, but the employer downsized, laid off him and a bunch of other employees. Jonathan lost his health care. He needed an expensive prescription to stay alive. During the brief time that he was unemployed, the prescription ran out. He could not afford to refill it. He got a new job offer. The job was to start on Monday, but he did not have the medication. He died on Saturday, 2 days before the new job was going to start, where he would get health benefits again. This is a screwy way to run health care. Other civilized nations recognize universal single payer. Washington State needs to join the civilized world and keep people like Jonathan alive.
Thank you, Mr. Anderson.
Hello. My name is Carol Butterfield. I'm a Seattle resident and a nurse practitioner and RN. I have a few things I want to say. First of all, I believe that healthcare is a human right. We also know that from a fiscal standpoint, absolutely, that deferring healthcare costs more in the end. Healthcare as a right creates equity among groups. One of the conservatives' favorite lines is that we have the best healthcare in the world. And while that might be true if you're at the very, very top, most people don't have access to that. It is also time to move forward. We live in a gig economy. This is the buzz phrase. Healthcare can no longer be tied to employment. It no longer makes sense. And I have a lot of other arguments, but my time's up. Thank you.
Thank you, Ms. Starfield.
Sorry. Thank you.
Catherine Angel, Jeff Johnson, and Mariana Hopkins Everson. And lining up behind this particular panel will be Ken Fabert, Matt Reddy, and Summer Stinson.
Good morning, and please begin. Introduce yourself.
Thank you. Good morning. My name is Catherine Angel. I'm a registered nurse for 35 years. I believe healthcare is a human right. People should not have to be stressed over how to pay for their healthcare when they're diagnosed with a devastating disease and have those stressors combined. I also have a personal story. I was diagnosed with lymphoma in 2002. I was off having chemotherapy. I ended up using up all my short-term disability. I wanted to go back to work, and I did. But I got sick again, and so I lost all my short-term disability, and I was almost without a job. That should not happen to anyone, and I had good insurance. I am an RN, so this needs to change. I think everybody deserves the health care, and my time is up. So,
Thank you, Ms. Angel. Please go right ahead. Good morning.
Good morning. I'm glad to be included today. My name is Mariana Hopkins Everson, and I'm here today because I believe health care is a human right. I'm a registered nurse, a mother, a wife, and a daughter, and because of those roles, I'm an activist whose main issue is health care for all people, not just people who can afford it. I worked in a rural hospital, and I could use my time to tell you 1,000 stories of people who would not have been in that critical care unit had it been that they had had high-quality health care from birth. People with endocarditis, an infection around the heart from a lifetime of poor dental care. People with infections that have spread through their body because they couldn't afford to go to the healthcare provider at the first sign of a problem, so now they have septic shock. And people with diabetes who return to the hospital time after time because they cannot afford their insulin. I could use my time to tell you about my wonderful mother. Happy birthday, Mom. Who lives on about $17,000 a year in Social Security, has a pre-existing condition, you know, because she's 74, and can't get supplemental plan for her Medicare. So her out-of-pocket costs are outrageous. I could tell you about my Desert Storm veteran husband, Brad, who has VA benefits, and his care there has been excellent despite what anyone can see as an underfunded and understaffed program. I could tell you any number of people's stories, but I want to make sure that what you hear today is the fact that we're talking about people, not money, which we would save in the single payer system, not access. I have access to a Porsche, but I can't afford one, and certainly not political capital like my representative told me in a recent meeting. We're talking about people who get sick and are dying out here. And while we all know in this room that the best solution to save lives and improve health is a single payer system.
Thank you very much.
Ken Fabert, Matt Reddy, and Summer Stinson. And on deck will be Sarah So, Leslie Zucker, and Paul Oldenkamp coming up after this panel.
Good morning. Who would like to begin?
I'll go.
You got notes.
So hi, I'm Matt Reddy. I'm actually an elected hospital commissioner in Jefferson County, Washington, East Jefferson County. But I'm not here today as a hospital commissioner. I'm here as a private citizen. I've been advocating for single payer health care for many years. My mother died of cancer about 11 years ago, and I cannot imagine the anger I would have at the system if my mother had gone through the system without superb health insurance, which she did, and which I have always done. But our system is unfair. If you're an elected leader today at any level, local, state, or national, I believe it's your duty to study how single-payer health care can be designed to cost us less and guarantee access to every person. Our country and our economy cannot thrive if people must live their life in terror of serious injury, pain, suffering, and death due to poor access to health care.
Mr. Reddy, if you could wrap up, and if you have anything you'd like to submit in writing, I'll ensure that that's distributed.
Sure. Thank you.
I'm Summer Stinson, a mom, public school advocate, and disability lawyer. I support SB 5701 and urge you to vote yes for AppleCare Trust. There's a strong intersection between healthcare and education. It's important to support and recognize the whole child. Children and families need health care in order to be secure and healthy, and I know many children on the AppleCare program, an excellent program, and so health care should be extended to all Washington residents. In Seattle, we're facing the fact that the bus drivers who transport our public school children often don't have health care because they don't make enough hours to be able to qualify for health care. They work at the beginning of the day and the end of the day. And so the people who are transporting my child to public school, some of them have health issues and they do not have health care. That is a tragedy. On a very personal note, I got divorced in November, and I just received my own health care card due to the fact that I have a job. And our health care should not be reliant on marital status, on the ability to pay, or your employment status. Thank you very much.
Thank you.
Hi, my name is Ken Fabert. I'm a family physician with 38 years under the bridge. I've seen it all, and probably most memorable for me are the injustices I've seen perpetrated by the health insurance industry and unwittingly by the political system. It's right. What is it about care people don't get with health care? It's that simple. It's not a commodity. It's not widgets. It's not computer screens. It's human beings. And I was so disgusted. I went to New Zealand to work for a year, and it was a single payer system, and I'm here to tell you it works. They spend 9% of GDP. We spend 19% of GDP. Everybody there has health care. Everybody pays $2 per prescription. By the way, you heard some lies from the pharmaceutical representative previously, just to go on record. But the fact is, you know, we can do better. We're wasting tons of money. We're killing people, and we're being inhumane in the process. Why can't we do this?
Thank you.
Sarah So, Leslie Zucker, and Paul Oldenkamp. And coming up after this panel will be William Justin Baird, Jeff Johnson, and Jean Brachon.
Good morning.
Good morning. My name is Sarah from Kirkland, Washington, and I've been working as a clinical cancer researcher for 17 years. My first 11 years were in a hospital environment, and more recently I've been in industry. One of my jobs at the hospital was writing appeal letters to insurance companies that had denied coverage. Without exception, everyone that I have worked with wants to cure cancer for all patients, not just those who can afford it. I work in the system, and there's no doubt in my mind that a bill like this would be several times better than what we have now. The #1 cause of bankruptcy is medical debt. This is wrong. People shouldn't need to crowdfund to pay for their health care. I myself have always been healthy and had excellent insurance, but I recently had a minor surgery. The financial advisor at my doctor's office said it would be 100% covered. When I checked in, the hospital gave me a card that said if I paid my bill within 30 days, I would get a 30% discount. I was billed the fees were $11,000. I was billed $1,300 and paid less than $1,000. It's ironic that only people that can afford it are given the discount. Fees are inflated, and only those without coverage are truly billed full price. Universal coverage does not include deductibles, copays, or provider networks. Providers wouldn't need to navigate the hundreds of different plans and modify their practice to get services covered. They could focus on medicine. My Canadian mother-in-law has lupus and doesn't pay anything for her care. Her prescriptions are less than $10. They will never leave Canada and can't understand why our system continues to be so broken. Quite frankly, neither can I. Please use your power to fix it. I feel like this is about more than healthcare. It's a social justice issue.
Thank you, Ms. So.
My name is Leslie Zucker. I'm the first vice chair of the State Democrats Disabilities Caucus and a board member for Whole Washington. When I was a freshman in college, I suffered a breakdown culminating in chronic mental health disabilities. For as cumbersome as it is coping with my conditions, it has been equally challenging dealing with avaricious insurance companies. Over the past 13 years, my family has spent well over $400,000 subsidizing the medical industrial complex. Thankfully, I was born into a wealthy enough family that I've been able to access the best doctors, the most innovative treatments, and the most cutting-edge pharmaceuticals. Every day I wonder what I would do if I were poor, if my family hadn't the means to pay for what my private insurance companies and more recently Medicare refused to cover. The answer, quite simply, is that I would not be alive today. I would have succumbed to suicide. It is imperative that we achieve a universal, comprehensive, single-payer program under Senate Bill 5701, one where everyone is deemed worthy of care, regardless of race, ability, or socioeconomic status. Thank you.
Ms. Zucker, thank you very much.
Good morning, Chair Cleveland and Senators. My name is Paul Oldenkamp. I live in Seattle and work in downtown Seattle as a computer programmer and systems analyst. Now, I've been interested in healthcare policy and practices since I studied healthcare economics at the University of Washington and Northwestern University. And last winter, when I learned about the proposals in Congress to change our healthcare federal programs, I became very alarmed at the effect that this would have on people in Washington state here. And I was wondering if there isn't something that we can do within Washington state to deal with the crisis that I was seeing was going to occur for a large number of our fellow citizens. And I became very interested, enthusiastic about the Apple Care Trust because it seems to me that it's a very practical and very possible kind of thing we can implement here in Washington state. And so I would urge you very much to move this forward and get a solution in place. Thank you.
Mr. Oldenkamp, very much.
William Justin Baird, Jeff Johnson, and Jean Brachon, and that will be our last panel. We also have 63 people signed in, Madam Chair, not wishing to testify, 59 pro and 4 con.
Good morning. Who would like to begin?
Good morning. I'm Justin Baird, a citizen of the state and the city of Seattle. I am a long-term chronic survivor of several issues, but I am more here because there are many people like my departed mother. She was an independent businesswoman, self-employed, could not get insurance because of the nature of what she did, would always pay when she had to for our health care cash, but would never give herself that care because she could not afford that. When she died 11 years ago, unlike the gentleman that spoke earlier, she did not have care, And we found that she had been living with it for so many years that it had been addressed earlier. She would have lived and would be still paying taxes and paying to the state of Washington to this day, contributing to her community, had she had the ability to have access to health care. So I know there are many people in this state in the same situation that my mother was in. We can not only keep the communities together and families together, but it's also for the economic well-being of our state. Health care for all is the right way to go. Thank you for supporting SB 5701.
Good morning, Mr. Johnson.
Chairwoman Cleveland, committee members, for the record, my name is Jeff Johnson. I'm president of the Washington State Labor Council, AFL-CIO. We represent about 400,000 union members. I'm also the chair of the Healthcare is a Human Right Coalition. You know, having healthcare we need, no matter who we are and regardless of our circumstances in life, is fundamental to our well-being as individuals and as a community and as a nation. The legislation before you, I think, is well thought out and it's appropriately phased in. I testified a few years ago for the need for the AppleCare Trust. Premiums were soaring at that time. Medical bankruptcies were an everyday event. The leading cause of labor management strife was healthcare benefits and costs. Despite obvious improvements given the Affordable Care Act, the need for this bill has become even more important. Some 25+ million people in the United States are still uninsured, and that number is increasing with the removal of the individual mandate with the congressional tax bill passed in December. Premiums have already been increasing in double-digit fashion, expected to rise another 10% again because of the tax bill. Healthcare is unaffordable for many. It's a lot of churning on the exchanges. One of my daughters struggles every month to pay her premium at the exchange, as well as to make rent and put food on the table. Millennials are struggling mightily over the current healthcare system we have. Medical costs still are the largest cause of bankruptcies. I encourage you to move this bill forward. The time is right. Thank you.
Thank you. Thank you for coming before the committee. It's good to have you here.
I'm Jean Brecken from Bellingham. I've been involved with single-payer healthcare for 17 years in Bellingham, United for National Healthcare. I'm 75 years old, and I want the bill out of committee so that I will have my $4,000 hearing aids covered, and also my income as a displaced worker. This bill provides for displaced worker coverage, which I will lose 75 to 85% of my income because I happen to be an insurance agent. 75 to 85% of your premiums that you pay for car insurance are bodily injury liability to other drivers. That's why your car insurance is getting higher and higher and higher. So I can speak to that personally. On a national moral level, I'm calling on your committee to change the course of our nation. This is how it starts. It is transformational, as the senator who brought the bill. It's one committee starting it and then the state going forward. So I would like us to change our nation from an unhealthy to a healthy nation. And finally, I would like to ask you to consider, in view of Martin Luther King Day just yesterday, the issue of race. White people, unfortunately, are being blamed for black people's poverty.
Ms. Breckham,
yellow.
We have to conclude testimony now.
All races. Would you please consider that it is mean and
thank you for being here today
to deny this care? Thank you.
One additional person that has signed up to testify. I'd like to call that person forward.
Erin Georgian, and Erin, on your way out, please sign in and make sure you indicate pro or con.
I apologize,
Or
my
other.
first time and I wasn't sure what I was supposed to.
Please go right ahead. Welcome to the committee.
My name is Erin Georgian, and I've been a physical therapist assistant for 18 years. I provided medicine in the Coast Guard and a truly socialized system, and I've provided medicine in for-profit, outpatient, inpatient, hospital, rehabilitation services. About 4 years ago, I started shifting careers because I got tired of spending 1/6 of my time documenting and charting or trying to get wheelchairs for MS patients, trying to convince insurance companies that spinal cord injuries need wheelchairs. I spent the next 3 years telling people how to get affordable health insurance, and what I found over and over again was some people just couldn't navigate the bureaucracy. But millions, I could only tell them what hole they fell in. Either they fell in the family affordability glitch where employers are not required to cover spouses at an affordable rate. They're not required to cover children at an affordable rate. I found people that fell into the Medicare problem of having to spend down to 100% of the poverty level before they could get help with their health care costs. I found over and over again that people did not have a place to go to get affordable health insurance, even if I could take the time to explain that to them. We spent the last year studying Washington State's healthcare system, and we agree with this proposal, and we have provided you with the research and information that we've got.
Thank you. And if you could leave that, we'll be sure it's distributed. And thank you for taking the time.
I appreciate it,
today.
Thank you.
And this concludes testimony on Senate Bill 5701. It does conclude the hearing on Senate Bill 5701. I'd like to close the hearing and now move to Senate Bill 6147. If we